At the Nelson Mandela Children's Hospital in Harley-Davidson, Mzansi celebrated First Responders Appreciation Day today. The day is dedicated to celebrating those professionals who often are the first to respond to crisis situations and improve the lives of patients at the hospital. Nelson Mandela Children's Hospital Communications Officer Ayabulela Poro joins us now in studio. Very good evening to you. Welcome. Thanks for joining us.
Thank you for having me.
An important day today, really just recognizing those who immediately attend when one is on the phone looking for help and often taking for granted what it takes for those first responders to be there. What is this initiation about?
Certainly an important day, and I think also the partnership itself, particularly with the Nelson Mandela Children's Hospital, also shines a light on pediatric healthcare in the country. Mm-hmm. So essentially we partnered up with Harley-Davidson through the Nelson Mandela Children's Fund, which is the founding organization of the hospital. Mm-hmm. And essentially Harley-Davidson and Mzansi said that they wanted to honor the first responders but also do something for the patients at the hospital. So we had a drive-through this morning from Fourways to the hospital in Parktown, where they essentially also dropped off some presents for the children and then also gave over a present, which was basically a jungle gym that's now positioned at the hospital. Oh,
that's fantastic. The responders, I mean, you speak about those who assist in the pediatric care, but when we speak about responders, it gets broader because there's also the police, there's also looking at the ambulance, medical care, as well as firefighters. Why is it so important to shine a spotlight on these individuals, more so when one is looking to get assistance at sometimes a situation which may be a matter of life and death?
Because I think they're so vital to the healthcare system, because they're always the ones on the ground and really the first at a time of emergency. So I think it's important again to also maybe have education around the role that they play, mm-hmm. but also the role that we can play as citizens, for instance. So it's simple things like knowing that you need to get out of the way should they need that path to get to a health facility. Yeah. So I think it's quite important to acknowledge them and to also see them as a greater part of the healthcare system, mm-hmm. but also to give them special recognition because they are the first ones to be on the scene.
Yeah, and how have they assisted when it comes to pediatric care? One would imagine that handling children would be slightly different to an adult in an emergency situation.
Certainly, and it is quite specialized. Yeah. So I mean, there's health as it relates to adults, but then there's a different ball game when you think about children in particular and the skills that come to that. If you think about a heart, for instance, a child's heart is going to be much smaller than an adult's. Mm-hmm. So you need someone who's actually trained with those skills to be able to deal with that. So I think it's quite important as well that we also focus on training and skills when it comes to also being able to handle pediatric healthcare when it comes to first responders.
And how did they receive today, you know, being acknowledged for work that you do, which, I mean, comes at a risk? I mean, very often we learn of how ambulances are attacked and robbed and how people's lives are essentially at the front line of danger.
Exactly. So I think that's the other thing, the fact that they're also putting themselves on the line. And oftentimes also, you know, they don't have access to the patients that they need to help. And that may be due to location or whatever the challenges may be. Mm-hmm. So I think today, again, being at the hospital and having our very own patients, you know, being able to say thank you for the work that they do, I think was very touching. Mm-hmm. And it's something that we hope to continue to do again with Harley-Davidson, Mzansi, the Nelson Mandela Children's Fund and the hospital.
What were some of the loopholes that this day identified when it comes to some of the gaps that need urgent attention within the healthcare system?
I think the first responders would be the ones to be able to tell you a bit more about the technical challenges that they face. But we know that resources are always scarce when it comes to, again, emergency services. And this is something, again, that I think would need to be looked into to be able to help them to do the work that is so essential, but also just so core when it comes to, again, providing health services. Mm-hmm.
And when it comes to the skill set that you were talking about, are you finding that perhaps there needs to be a lot more of an educational drive around ensuring that there is that extra sensitivity? I mean, things are rushed. It's an emergency situation, a matter of life and death, you know, rushing within the traffic and sometimes having people, as you make mention, often being a hindrance on the road, not wanting to move in time when this emergency vehicle needs to get to the hospital.
Exactly. So on both sides, right? The fact that we have to focus on the skills of the actual practitioners that are on the ground and how we can support them, but also I think an information education drive around citizens and the role that they play. Because again, we're talking about what can happen in a matter of seconds here. So every second matters, and we all have a role to play. It's not just in their hands, but also we as citizens have a role to play to make sure that, again, the people in those emergency situations are able to get the assistance that they need.
What were some of the emotions expressed by the first responders on this day? I mean, being honored, being recognized, which is not always the case. What was some of the reaction and some of the heartwarming conversations?
Certainly something that they're looking forward to, I think, next year, and us being able to do it on an annual basis. I think also being able to chat to the patients who were there during the event. Oftentimes they don't get that chance because you're only meeting the patients in the emergency situation, but then being able to talk to a child who's now gone through that traumatic experience, but also to be able to sit down with them and see them doing better, I think was really affirming for them.
What about the tools do you think are needed around the trauma? I mean, the trauma of being rushed in an ambulance and really having some sort of psychological backing around that very hectic space. I mean, you get the ambulance rushing, you get the responders who are there, who themselves would, in some instances, need some psychological support for what they see. It does get really harrowing and devastating.
It does, and again, you don't always have the best outcomes. So I think, again, at it being October and us looking at mental health issues, and especially for healthcare workers, I think it is quite important for us to be able to consider how we will look holistically at the services that they're providing, but the assistance that they need as well, besides the technical training that might be required to be able to react in a situation like that.
What would you say were some of the highlights today?
Definitely seeing the interactions between the first responders and the children. And I think, again, with such a unique environment where you have a children's hospital there to just serve children and then being able to receive toys that they can now own. For some of these children, that is the first time they're ever receiving a gift. So that is really heartwarming, and I think will set a lasting impression on them.
Absolutely. Thank you so much for coming to studio to talk to us about this very heartwarming, celebrating the First Responders Appreciation Day today. That was the Communications Officer at the Nelson Mandela Children's Hospital, Ayabulela Poro, expanding on really recognizing those who are at the front line when it comes to danger and responding to emergency situations.